Hi, I'm Natasha Frakes. We're here at the Alpha North Capital Event Conference in the Bahamas. I'm here with Jason Flowerday, who is the CEO of 3D Signatures. Jason, thank you so much for being here.
My pleasure. Nice to meet you, Natasha.
Now tell us about 3D Signatures.
So 3D Signatures is a fascinating company. We span a space that's somewhere between molecular diagnostics and bioinformatics. The business we're in, Natasha, is the business of personalizing cancer care treatment for patients who have an array of cancers. Our co-founder, Dr. Sabina Mai, has been a prolific researcher and been fortunate to collaborate with clinicians all across Canada as well as other leading centers in Europe and the US. And to date, we've been able to identify a really unique approach to understanding which patients have a very aggressive form of cancer and perhaps what type of therapy is best suited to them. So it's an exciting time, a really novel approach for us, and this represents an important inflection point for the company. 2018 is going to be a big year.
You mentioned one of the doctors. Can you tell me a little bit more about your team?
Sure. So we have a small team. Most of them have PhDs. I don't. But everybody's a scientist, and they're very well versed in the approach that Sabina pioneered years ago. The approach that we take and the scientists that are leading it is all based on telomeres. Telomeres are something people hear about in the press day in, day out, but our use and our appreciation of telomeres is really quite unique. We're using it as a surrogate, almost as a way of mapping the inside of a cancer patient's nucleus so that we can essentially create a morphological or 3D map of that patient's DNA. That map tells us how disorganized or organized that patient's chromosomes and their DNA is. That's a strong indicator of how likely their cancer is to be more aggressive or less aggressive than somebody else. And so it's really the advent of precision medicine, personalized medicine, and I think 3D Signatures is going to have a promising future.
Tell me more about that. What do you have to look forward to over the next year?
Sure. So over the course of the last year, we laid out a very detailed clinical development plan for our leading test for Hodgkin's lymphoma. So we have 5 key programs which we're bringing to market, and in 2018, we expect to announce the results of our recent Hodgkin's lymphoma trial. That'll be an important validation for what is otherwise a very unknown and unfamiliar technology to most clinicians and certainly most investors. Behind the results, which we'll announce shortly on Hodgkin's lymphoma, we have a number of exciting pilot studies in place. We have an ongoing trial for prostate cancer where we're using something called a liquid biopsy. So as opposed to a biopsy to the prostate, it's based on a blood test and being able to find what are called circulating tumor cells in patients that have prostate cancer. We're also anticipating the launch of other pilot studies in multiple myeloma, in lung cancer, and really a bit of a one-off is we have a really exciting platform in Alzheimer's disease where we've done prior research based on cheek cells. So buccal cells from the inside of a cheek, where we've been able to diagnose patients with various stages of Alzheimer's disease as well as mild cognitive impairment. So a lot of that is moving forward in the next couple of quarters, and we expect to make some big announcements in the next little while.
It sounds like you guys are doing some really interesting work. Thank you so much for being here, Jason.
It's my pleasure, Natasha. Thanks so much for having us, and we're excited about the year ahead.